My name is Rolf Barth. I'm a professor of surgery in the section of transplantation. At Chicago, I perform organ transplants of all types. I do liver, kidney, and pancreas transplants. I think my role here is engaged in all the different types of end-stage organ disease that we see with patients, and trying to come up with creative solutions on how to get them transplanted. Over the last decade, 2 decades, we see a consistently evolving landscape for organ transplantation. And I think what that means is people with new diseases that could benefit from a transplant, people who've been potentially told by other places that they may not be a good transplant candidate, are kind of increasingly being considered as candidates. And I think as transplant providers, both surgeons like myself and my medical colleagues, we're trying to come up with ways to get to yes, to get to a successful organ transplant. I think taking care of patients is pretty easy for a lot of us. You know, we are a patient-focused program. The physicians are the ones connecting to the patients, their families. I really believe that, my connection to a patient isn't just to be a surgeon and do a technical procedure, but to help them navigate the numerous considerations before a transplant or organ donation. The actual surgical procedure, of course, is the paramount event, but also after the surgery, celebrating the success and helping manage recovery to really getting back to full function. I like help, being part of a big team, being part of a group that can accomplish things together that they can't individually. Transplant is very much a team sport. The surgical procedures often involve multiple surgeons. The care of the patient involves multiple medical specialties, pharmacists, nutritionists, social workers, nurses, a really large group of people trying to achieve a common goal.